Hello, my name is Melanie Jones. I'm with Western Governors University, and this is my LUT1 presentation. Today, I would like to talk to you about depression in cancer patients. Researchers have found that cancer patients that have symptoms of depression have had as much as a 25% higher death rate than cancer patients without depression. Research suggests that untreated depression has a major effect on newly diagnosed cancer patients' survival rates because of the psychological and physical factors that may affect them. There's ample evidence that depression can manifest in many ways that can make it hard to diagnose and to treat. The diagram behind us shows different physical and psychological factors that may affect a patient's cancer and their survival rates. With the fact that cancer patients have a high chance of developing clinical depression, all clinicians should be aware of these symptoms and watch for the symptoms and ask the appropriate questions to get to a diagnosis. Symptoms are sometimes missed because they are so subtle. They have little things like loss of interest under psychological symptoms or even pain under physical symptoms. Because some of the symptoms listed are so similar and directly related to the cancer, such as pain, pain can be mistaken as for the cancer and not as a depression symptom. So some clinicians may have a hard time distinguishing this as a depression symptom. The diagram shows many different physical and psychological symptoms, so we should also, every person should be aware of them and for our patients and our loved ones. As we look at these symptoms, let us explore how these symptoms are directly related to our cancer survival rates. Depression in patients newly diagnosed with cancer shows to be more effective on their treatment. It affects the way they decide how to treat their cancer. Depression has an impact on mental capabilities of the cancer patient and their abilities to make decisions. The concerns about the cancer and the possibility of death can lead a patient to alter perceptions of life. And another barrier that cancer patients with psychological factors can encounter is the reluctance of talking to a professional about their symptoms. Psychological distress is hard for a lot of people to discuss, making it hard for them to approach clinicians, counselors, or even their loved ones to seek that help or that care. Psychological symptoms such as loss of interest, anxiety, irritability, those can also lead to increased symptoms of depression and can also lead to poor decision making by our patients. A loss of interest and low mood are actually really key to symptoms of depression, and many times are mentioned in more than half of our patients that we assess, making that a real common factor to be looking for. The physical symptoms. The physical symptoms are more overlooked because it's hard to relate them to depression. Physical symptoms can range from simple fatigue to a decreased ability to concentrate. Another reason depression may hinder the cancer rate of survival is that battling both cancer and depression that makes the patients feel a little bit more distressed and makes it more difficult for them to just go through everyday tasks. And because the symptoms occur with many conditions, many depressed people never even get the help because they don't even realize that these physical symptoms may be related to depression. And untreated depression, and the physical symptoms can also affect their abilities to make decisions because they, pain and loss of appetite, they can be related to the chemotherapy. The pain can be related to the cancer, so they don't really know that the proper decisions are to treat these symptoms as a depression-related symptom. In conclusion, untreated depression definitely affects our cancer survival rates, And patients with cancers do have a higher rate of psychological and physical factors that can lead to poor decision making and lead us to the correct way to get them diagnosed. Depression can be directly related to the survival of patients diagnosed with cancer, and healthcare professionals need to assure that depression screenings are on a regular basis on all patients diagnosed with cancer so that we can catch these symptoms and get them treated for patients to help improve their survival of their cancer rates. Do I have any questions?
Yes, I have a quick question from you.
Yes, sir.
My name is David. A lot of times, we wonder why is it important to diagnose depression as early as possible?
Well, David, mental comorbidities are getting a lot of recognition lately, and depression may contribute to barriers for patients and the treatment. So the quicker we can get to those barriers, the quicker we can get them treated and also increase their survival rates.
Okay. I'm sorry. I have another question.
Yes, sir.
Wouldn't depression be a common response if diagnosed with cancer?
Depression is a common response for cancer patients. It's a common diagnosis when it's caught. Because it's directly related to symptoms, it also burdens them with the fear and the low quality of life. Some symptoms are mild, as well other ones really affect the way of the patient's life.
Okay, thank you.
Okay, do I have any other questions?
No.
Okay. Well, thank y'all so much for visiting my presentation today.